A devastating explosion tore through a nursing home in Bristol Township, Pennsylvania, on Tuesday afternoon, setting off a massive emergency response and leaving the local community reeling as firefighters and rescue crews worked for hours to evacuate residents and search the heavily damaged building. Please subscribe, like, and share. Thanks. Now back to the story. The explosion occurred shortly after 2 p.m. at the Silver Lake Nursing and Rehabilitation Center, a long-term care facility that houses elderly residents, many of whom have limited mobility or complex medical needs. Neighbors reported hearing a thunderous boom that rattled windows and shook nearby homes, followed by flames and a towering column of dark smoke that could be seen from miles away. Within minutes, dozens of fire trucks, ambulances, and police vehicles flooded the area as authorities declared a mass casualty incident. Fire department from Bucks County, surrounding municipalities, and neighboring counties responded, along with state emergency management officials. Roads near the facility were shut down as crews worked to gain control of the scene and ensure access for emergency vehicles. Officials confirmed that multiple residents and staff members were injured, though the exact number and severity of injuries had not been finalized by Tuesday night. Several victims were transported to nearby hospitals, while others were treated on-site for smoke inhalation and minor injuries. Rescue teams were seen carrying residents out on stretchers and assisting others in wheelchairs or wrapped in blankets against the cold. The explosion caused significant structural damage, with parts of the building partially collapsing. Debris littered the ground around the facility, making rescue operations dangerous and slow. Firefighters worked cautiously to stabilize the structure while conducting room-by-room searches to ensure all residents and employees were accounted for. Some residents were believed to have been trapped inside the building in the immediate aftermath of the blast, prompting urgent search and rescue efforts. Crews used specialized equipment and thermal imaging cameras as they navigated through smoke-filled corridors and damaged sections of the facility. Bristol Township officials activated emergency evacuation and reunification plans as families of residents rushed to the area seeking information. Temporary shelters and reunification centers were prepared to house displaced residents and allow families to reconnect with loved ones. Authorities urged relatives to remain patient as first responders focused on rescue operations and medical care. While the cause of the explosion has not yet been officially determined, early indications suggest a possible gas leak, according to emergency officials at the scene. Investigators from state and local agencies, including utility and building safety authorities, are expected to conduct a thorough investigation once the site is deemed safe. Local leaders praised a swift and coordinated response by first responders, noting that the rapid evacuation likely prevented a far worse outcome. This could have been much more tragic, one official said, emphasizing the bravery of firefighters, paramedics, and staff members who helped residents escape. Residents living near the facility described scenes of chaos and fear as sirens filled the air and smoke drifted across the neighborhood. Many expressed concern for the vulnerable population inside the nursing home, especially given the timing of the incident during the holiday season. As night fell, emergency crews remained on scene, continuing recovery efforts and monitoring for potential hazards. Officials said updates will be provided as more information becomes available and urged the public to avoid speculation while the investigation continues. The explosion has left the Bristol Township community shaken, with many offering prayers and support for the injured residents, their families, and the staff affected by the disaster.